Hi, today we will be addressing one of the challenging topics, diabetes, right? How to treat diabetes. If you have seen people who have diabetes, it is not very surprising to see many patients who are having their blood sugars in the range of 200, 350, 400, and they are either taking medicines, insulin, taking some five, six categories of medicine, some 10 tablets per day to prevent, heart attack, stroke, and other complications. Most of them also have hypertension along with that. But it is not very surprising to see them with those high blood sugar levels despite taking medicines. Now, how to treat those patients? How to reduce such blood sugar levels from 300, 400 to a level which is acceptable, like 100, 150, like that. And why is it such a big challenge? Why are those medicines, despite they taking medicines, they are finding it difficult to get the sugars in normal range? It is simply because there is something critically not addressed. Unfortunately, right now, by many, many times when you meet doctors also, this part is not addressed. This no one speaks about it. So your sugars continue to remain at a higher level, like 300, 400, without making much of a difference. In fact, there are many researchers that show that despite taking many medicines, like people who are even taking tablets for diabetes, for example, the complication that can happen in those diabetic patients, like in those patients with diabetes, they are not reduced. People still continue to have heart attacks, strokes, continue to develop other complications of diabetes. So what is that is not getting addressed? Why are, despite having such nice medicines, people are not getting to control their blood sugar levels? Let me give you um, a sample of this, like why, with a real life example that happened with me. Once I was, seeing a patient, and he came to me. He was an elderly gentleman, around 75-year-old. He was neatly dressed, early morning, in front of me in a hospital. He brings a neat file, which is, which is like his health profile, all the reports, old reports, neatly organized. All the prescriptions he is taking, that is also there, neatly, organized in that file. And I'm looking at that. And when I looked at him, he was like, like he was like really a gentleman, a white shirt, a gray pant, fully dressed well, elderly, will like fully combed hair. Um, and he was sitting there, And when I looked at his reports, all of them were under control. Like fasting sugar was 140, after food sugar was around 160. For his age, it is acceptable. Some reports were in the borderline, and he was taking tablets regularly, and he was maybe looking at me with a sense of pride that I will say something for him, to say like very good job. And yeah, he was doing a good job of maintaining sugar numbers. But when I asked him one question, he was shocked. I asked him, why you got diabetes? And for him, it took for some time, like, and he is surprised by that question. And he said, uh, no one asked me this question. I'm having diabetes since 20 years, and no one asked me this question of why you got diabetes. He said, first, I don't know. Then I asked him, look at your lifestyle and tell me, what are you doing that may be putting you at risk of diabetes? Then he looked, thought about it for some time, and said, um, maybe I'm not sleeping on time. I every day watch movie till 1:30, 2 a.m. with my wife. I asked him, are you still continuing to do that? He said, yes. I asked him to immediately stop that. And this story may give you a sense, because I told him, if you continue to do that, night awakenings, late night awakenings till 1:30, 2 o'clock, you are still at the risk of all the bad lifestyle habits that it can give you. You're still at risk. Many people mistake managing diabetes to controlling blood sugar levels only, and that's the problem. If your sugars are 400, we can give you any number of units of insulin and bring it to normal. That doesn't mean you will be healthy. For you to be literally being healthy, you have to address both the blood sugar levels and why you got that elevated blood sugar levels. It's like it's like when your house is on fire, you have to you have to douse that fire as well as catch the thief who put the fire there. If you're only dousing the fire and leaving the thief free, he's going to destroy your home again. Your home is not safe. So if you're controlling your blood sugar levels, all your attention is on taking the right medicines and controlling blood sugar levels, the the reason why you got diabetes, that is still not managed. Whether it is because of overeating, less sleeping, not exercising, not attending to your hydration, not chewing the food, or drinking excess coffee, or having cool drinks, unless you give your attention on that particular habit or those particular habits that also caused your blood sugar levels to go high. Even if you're managing blood sugar levels in normal range, you're at risk of developing all the other lifestyle, like your tablet is going to increase then for hypertension. And when you have heart attack, and if it is non-fatal, when you get stroke and that is non-fatal, then those medicines keep adding up. It's not the failure of those medicines. Those can actually do the job of reducing blood sugar levels. The the most critical part that is missing is this question, being a part of diabetes management, like why you got diabetes. If you don't have an answer for that, then you have to keep looking an answer for that so that you can start to address that. And by the way, one answer I've seen some people give and wash their hands off is my genetics. My mother had, my father had, so I will have it. Okay. Well, maybe it largely decides, okay. But in such patients also, if you ask them at what age your mother got diabetes, at what age your father got diabetes, and they're addressing the number 60, 65, 70, and you are saying the number 25, 30, then man, you have used that genetics as an excuse to continue to be carefree, did not give attention on your health, and now you are risking being a diabetic at the age of 25, 30. By the way, nowadays diabetes has shifted to the age group of 20 to 25. It's not, again, very uncommon to find. When I was doing my MBBS, the age group I was listening was 50, 60, like that. As I was doing my, higher studies, then the age group was around 40, 35. Now I see very commonly people with 20 to 25 age, even lesser than that sometimes, getting diabetes because of this poorly managed lifestyle and the lack of addressing the question why you got the diabetes. Okay. So I hope this video will help you students, future doctors, to manage diabetes, and help patients who are getting these abnormal blood sugar levels into control. And if you are a patient who is watching this, and if no one has asked this question yet, you can ask yourself, you can go in front of the mirror and ask this question: why did I get diabetes? And if you still see the answers and they're still persistent with you, please address them. That's the next step. And that's how you reduce your 300, 400 sugars to 100, 150. In fact, till the time your sugars are not in the range of 100 to 150, even if you're taking 4 or 5 tablets, your treatment has not started. Only when the blood sugars are under control, you can start saying, okay, now my treatment has started. Okay, with this information, I hope you will manage your diabetes better. We'll see you soon with, another information that can support, in being healthy and taking care of patients.